My name is Dr. Bradshaw, and this film is intended for the use of my students in Normal Rad 1611 and for the review purposes for my students in Normal Rad 2612. On this video, I wanted to discuss the cervical oblique views, and this picture is coming straight from Yoakum Monroe, and it is the film that is numbered in the textbook. And I chose to use this one because if you're looking at your textbook, I also want you to realize that you have four cervical oblique views. You have a left anterior, you have a left posterior, you have a right anterior, and you have a right posterior. How would we know which one is which is by the location of the marker and what is it closer to. If you had a right marker right here on this side, closer to this vertebral body than it is to the spinous process, then that would tell you that that is a right posterior oblique. However, if you had a left marker right here on this side, closer to the spinous than it is to this vertebral body, that would tell me that I have a left anterior oblique. On either of those two views, you are looking at the left IVF. And so this film is taken primarily for one reason and one reason only, and that is to look at the condition of the IVFs in the cervical spine. Now you know that what is coming through that IVF is a nerve root, and so if you see an encroachment of the foramen, then you know that you have a problem at the level of the nerve root. As we get started with these, number one is on the vertebral body, and so all of this, of course, is the vertebral body. Number two is labeling the transverse process, which is coming across right here. Remember that it is a trough-like shape, and so you're sort of looking at this one on end, and that is the transverse process. Number three, which is right here, and if I went to this segment, would be right here. And so we have the TP and the pedicle. Number three is labeling the pedicle. Number 4 and 5 sometimes are confusing to students. Remember that we have this person turned at a 45-degree angle to the film. And so what we're seeing here is right here where it's really white is the lamina, but it's also superimposing all of this structure right here, which is labeled number 5, is the articular pillar. So all of this is the articular pillar, and this really white part right here is the lamina. So number 4 is labeling the lamina, and number 5 is labeling the articular pillar. Number 6 is labeling this spinous process right here, and so the spinous process is out here behind. Now, why we don't see spinuses up in this area is because spinuses of 3, 4, and 5 do not have a lot of density, and so they do not always show up on this view as easily as down in the C6, C7 area. If I look for item number 7, that would be this right here, and of course this would be the IVF. Number 8 is labeling the joint that is between this uncinate process and this uncinate fossa, and the name of that joint is the joint of Luschka. Number 9 is labeling the pedicle. The pedicle is right here, and this is the pedicle that I'm going to describe in class as the bar, because you're seeing one sort of oblong, and you're seeing this one, which is this circle right here, and that's what number 10 is labeling on the segment above. That is the pedicle that you're looking at on end. And I use the word circle in class to describe this on lecture material and on testing material. So this is the circle, and this is the bar. This is the bar. So this is on the circle, number 10 is on the circle, and here would be the bar. So that is 9 and 10. Number 11 is labeling the transverse process that is extended out right here. Number 12 is on this spinous process that is right here, but we do have a rib that is coming in and articulating, and so you're seeing part of that rib come in right here, and you usually will see a transverse process right here in this area as well. We can see on this film that's not numbered, right here would be the hyoid. Also not numbered right here would be one side angle of the mandible, and the other side is right here. We can see the posterior tubercle right here, which is not numbered, and of course this would be part of the posterior arch, and this would be part of the posterior arch. And so my next question to you would be, why do we see two sides of the posterior arch not superimposing each other? Is because you do have tube tilt on this film. Now, if this was a left anterior, the tube tilt would be caudal, and if this was a right posterior, the tube tilt would be cephalad. Number 14 is just labeling the mandible itself, and I believe that's everything that has been labeled on this film. Have a good afternoon.